Hello everyone, welcome back to my channel. Today, which topic we are discussing, that is relationship between anemia and hemoglobin. So without delay, let's start. First you have to know what is hemoglobin and anemia. So anemia is a condition in which you lack enough healthy red blood cell to carry adequate oxygen to your body tissue. Having anemia, also refers to as a low hemoglobin, can make you feel tired and weak. And hemoglobin is what? Hemoglobin is actually a protein based component, you can say, because hemo and globin both are combined together and it's produce hemoglobin. Hemo means iron and globin means protein. So when in our body lack of hemoglobin is present, in this condition we are telling anemia. Okay, so anemia, when we are facing this anemia, we have different type of symptoms. Different type of symptoms are sometimes fatigue, weakness, pale or yellow skin, irregular heartbeat, and dizziness, chest pain, okay, headaches, and lots of different type of problem we are facing in this condition of anemia. So anemia types, different types of anemia is there, uh, like iron deficiency anemia, vitamin deficiency anemia, aplastic anemia, sickle cell anemia, thalassemia. Okay, but today's our focusing point is actually iron deficiency anemia. What is the basic cause of this anemia? We need to know. As we are discussing here, iron deficiency anemia, the most common type of anemia, it is caused by shortage of iron in your body. Your bone marrow needs iron to make hemoglobin. Without adequate iron, your body can produce enough hemoglobin for red blood cells. Without iron supplementation, this type of anemia occurs in many pregnant women. It's also caused by blood loss, such as sometime heavy menstrual cycle, or ulcer in stomach, or sometime cancers, or some bowel problems. Okay, so these are the basic cause. Or sometimes some of the person who are taking different type of medicine regularly, that's also a cause of this disease. It's important to determine the source of iron deficiency to prevent this specific condition. Another cause of anemia is vitamin deficiency anemia. Beside iron, your body needs folate and vitamin B12 to produce enough healthy red blood cell. A diet lacking in this and another key nutrient can also cause decreased red blood cell production. Some people who consume enough vitamin B12 are not able to absorb the vitamin. Suppose you are taking lots of foods but in your body can't able to absorb it, then also you can face this kind of problem, because after taking the food you need to absorb it, your body need to absorb it, either there is no importance of this kind of food. So that type of problem we are facing in this vitamin deficiency, I mean vitamin B12 deficiency anemia, which is also known as pernicious anemia. Okay, sometime anemia due to inflation, like certain disease like such as cancer, HIV, rheumatoid arthritis, kidney disease. Okay, and another acute or chronic inflammation disease can interface with the productions of red blood cell. Okay, another thing is aplastic anemia. The rare life-threatening anemia occurs when your body does not produce enough red blood cell. Cause of aplastic anemia including infection, certain medicine, and autoimmune disease. Some of the person have actually this kind of autoimmune disease, and sometimes exposures to toxic chemicals. So these are the basic cause of aplastic anemia. Okay, and another is sickle cell anemia. It is inherited and sometimes serious condition is a hemolytic anemia. It's caused by a defective form of hemoglobin that force red blood cell to assume and absorb sickle shape. These irregular blood cells die permanently, prematurely sometimes, resulting in a chronic storage of red blood cell. And another types of anemia is hemolytic anemia. This group of anemia developed when red blood cells are destroyed faster than bone marrow can replace them. Certain blood diseases increase red blood cell destruction. Okay, so these are the basically different types of anemia and their cause. So as we can see, not only iron, sometimes iron deficiency is also there. Suppose a person is not taking proper amount of iron rich foods or different type of vitamin foods, especially vitamin B12 or sometimes vitamin C, or some of the person if they have different type of inflammation disease or any kind of autoimmune disease, or sometimes can't able to produce RBC or sometimes premature RBC. So due to that reasons we can face anemia. So now we can able to know what are the basic cause of anemia. But when you know the cause, we need to know how can we prevent this, because when we are facing the condition, we need to know the way of prevention. Here some of the magical food lists which actually help us to prevent anemia. So what are they? They are basically chicken, different types of liver part you can take. Beef, potatoes, broccolis, okay, peas and spinach, resins, dried fruits, walnut, watermelons. These are the egg also. These all are the good source of iron rich foods. Okay, so these all food if you keep in your regular based diet, and with this also green leafy vegetables, folate item, okay, bread, rice, definitely cereal products, and different type of vitamin B12 product if you keep in your food, then also you can prevent it. And also don't forget this, we need to observe the food. For that reason we need vitamin C type of foods. From this all magical food list, one of the most important food item, that is beetroot. Actually beetroot is a very very important food item for the patient who are facing this condition, that means anemia, because it's a high rich in folic acid necessary to produce red blood cells, and it is traditionally we are using this product for preventing anemia. Next is spinach, which is very very helpful for us, for all of us actually. It helps to maintain weight loss, enhance our immunity, improve eyesight, control blood pressure, cancer preventive, act as a cancer preventive, anti-aging property it has, and it helps us to protect heart attack also. So these are the basic benefit of the spinach. So we need to take this. And the another product which we can't forget, that is actually resins, which is very good, high rich of iron foods, because it helps us to produce RBC, prevent our gut health, prevent us from the disease, that is anemia, and also from different another kind of diseases. It helps to enhance immunity, and it helps to enhance our vision powers, it helps to enhance our digestion, and also it gives us a certain energy if we are taking. And it's also the most important part of the resins is, which is not related with anemia also, it helps to boost our nervous system, okay, and bone health also, because as we are talking about anemia, bone health is a very important part, right? So resin is a very important part. Who are facing this disease, for all of them I'm telling you, take resins each and every day. It will be helpful for you. And the another part which we can't forget, that is pomegranate, which is a more important things. If you take regularly 1 pomegranate in your diet, it will definitely enhance your health quality. Like for examples, it acts as an antioxidants, and it helps us to enhance hemoglobin levels. By that way we can protect anemia. It's give us anti-inflammation property, and it's act as a blood thinners. It's reduce cholesterols. Okay, so these are the basic functions of this food item. So you need to take at least one. If you can't able to take regularly, at least alternatively, I mean within a week, if you take 3 or 4 days, it will be helpful for you. And the another product which we can't forget, that is vitamin C. Vitamin C, for examples, different type of citrus foods. We all know, like different type of lemon we can take, tomato, melons, strawberries, and broccolis. Okay, so these are the things we can take in our diet. We can keep also, which helps us which helps us to increase our absorptions, and also act as an antioxidant. That means helps to reduce the bad cell from our body, and it helps us to increase our energy. Okay, it's boost our energy. It's also maintain our skin properly, hair properly. Lots of different type of advantages is also there. So we will get lots of benefit from vitamin C, not only preventing anemia. Okay, and another is that after all food, you need to take proper amount of water regularly, and at least try to do little bit exercise. Okay, you need to maintain your proper diet. Definitely with this diet, sometimes suppose after blood testing, if you see lots, your hemoglobin level is too less, you need to go to the doctors, and you need to take the advice from them. And after that, you need to start supplement. Don't start supplement from yourself. Okay, by taking advice only you can start. Okay, and start iron therapy. At least maintain it 2 to 3 months. After, you need to check hemoglobin level. Okay, and if you maintain this, you only can prevent this condition, prevent this disease actually. And so at the last, we can say, especially lots of risk factors we can see in these conditions of anemia, and especially pregnant women and adolescents, girls maximum they are facing. It's not mean ki boys are not facing, boys are also facing, but amount is less, the percentage is less. So at the last, we can say, take proper amount of water regularly, try to do exercise little bit, and also try to take proper amount of food. Don't try to skip it, try to maintain it regularly. Okay, by that way only you can able to prevent the conditions. If need, try to take supplement type of iron tablets. Okay, these are the basic way out how can you prevent anemia. Thank you for listening.
Meet in next video. Bye bye. Don't forget to subscribe.